Millions of people every year are affected by dizziness. Benign paroxysmal positional vertigo is one of the most common. It's called BPPV for short. BPPV is most characterized by a spinning sensation, most often when the person is laying down, rolling over in bed to a certain side, looking to a certain side, or sometimes looking up towards the ceiling. What happens with BPPV is there are naturally occurring calcium crystals in the inner ear that become dislodged, move to another portion of the inner ear called the semicircular canals. With these positional changes, like the rolling over in bed, the crystals in the semicircular canals stimulate nerve endings, causing the dizziness. So with physical therapy, we're able to reposition these calcium crystals from the semicircular canal to where they're supposed to be in the utricle of the inner ear. So with evaluation, Christine here was noting dizziness when she looks to the right, when she rolls over in bed to the right. So with evaluation, we were able to determine that it is the right ear that is affected. So we're going to take her through the Epley maneuver, which is one of the maneuvers that the physical therapist is able to do to reset those calcium crystals. So, Christine, what we're going to do is we're going to lay back rather quickly. I'll have a hold of you so that you're not going to fall off the table or anything. So, on my count, 1, 2, 3. With this, we have a specific head turn that we like to do. It's often that the patient will feel dizzy whenever we do this maneuver. That's normal. What we do is reassure patients that they're not going to fall, and that we'll have a hold of them during the whole treatment. How you feeling? Good. We hold each position for 30 to 60 seconds to assure that the calcium crystals are being reset. Okay, Christine, we're going to turn your head to the left for the second step of the process, okay? It's important for the patient to keep their eyes open during this process so that we can watch for any eye movement. It's one way that the physical therapist is able to detect symptom changes or that the treatment is being effective. Again, we're holding this for 30 to 60 seconds. Okay, Christine, what I'm going to have you do is go ahead and roll onto your left side, okay? It's important, again, that they maintain that head position while they're going through the treatment. How are you feeling? Good. Okay, for the last part of the treatment, Christine, I'm going to have you go ahead and sit up on the edge of the table, okay? 1, 2, 3. And that's the Epley maneuver. After the treatment is concluded, the patient is given home exercise program just for some exercises to help with their dizziness, as well as a list of positions that we like the patient to avoid. After the initial treatment, usually the follow-up treatments after a week following. And typically, symptoms are resolved in 1 to 3 treatment sessions.